So you are on mute, Grace.
You began. Yeah.
Good morning, everyone. I'm privileged to be on this platform and to thank the VAC Foundation for organizing this. We are really privileged as, startup foundations that are really growing and using the basics from different people to improve what we started. So it's an honor to be here, and good morning once again to each and everyone. I'm Grace Nagawa. Yeah, I'm a nurse by profession and the CEO of Endometriosis Foundation Uganda. So today, I don't know, should we start with a presentation?
Yes, we are ready to start, and I'm hoping that you also share your social media so people can go and like your page.
Okay. Yeah. So I may not follow the PowerPoint. Yeah, but at least we shall get it all. So we are going to look at endometriosis. So endometriosis is that chronic illness that really affects almost 1 in 10 women. Actually, data states that 1 in 10 women have this condition. And to us in Uganda, we are really looking at this percentage, this ratio, that almost 2 in 10 women, 10 ladies have this condition. So endometriosis is a chronic disease where the inner lining of the uterus grows in other places outside the womb. When we look at the uterus, it has 3 layers. Sorry? It has 3 layers. It has the inner layer, it has the outer layer, and the middle layer. So the inner layer is the endometrium, like you can see. And once this endometrium is when a woman bleeds, that a woman should bleed normally without pain. But we are going to look at the complications of endometriosis, signs and symptoms of this condition. You find that when the endometrium grows outside your womb, it's what we call endometriosis. We also have what we call adenomyosis. And adenomyosis is when this endometrium, instead of course, we know that it's supposed to be inside your womb. So as a woman bleeds, we have to bleed normally. The endometrium gives way. This blood comes out with normal cells. And then maybe the egg that didn't meet the sperm, so all that moves out. But there are incidences where this layer, the endometrium, moves out, it embeds anywhere. So with adenomyosis, this layer, the endometrium, moving in the middle of your uterine lining, that is what we call adenomyosis. So endometriosis can affect a woman anywhere. We have incidences where you can have this layer on the brain. It has been found on the lungs. Yeah, part of some of the members on the group for sure. Currently, we are over 100 ladies in Uganda, and we also have some from other countries joining us. You find that some people really have it on the lungs. So it affects you everywhere. And this depends on the stage. So we have stages of endometriosis where we have stage 1, stage 2, stage 3, and stage 4. So when we get to stage 4, to stage 1, that means with stage 1, that layer will be like in one position. And there you may have a scar, you may have a small adhesion with no masses, and it's already in one position. So these are women, these are young ladies you find with pain, but mostly only during their periods. That's why we have to talk about these stages so that people get to know how this condition comes about, because it's one of the conditions that are mistaken for other conditions, and which leads to delay in diagnosis. So with stage 1, most of these ladies have pain during their periods. So as we go to stage 4, it means that implants have started, getting deeper. You have more adhesions, and then the pain will start either before your periods, a few days, during, and then after, a few days after. So with stage 3, you find that the endometrial depots have exceeded one position. So endometriosis, this layer once it's outside, it keeps expanding. It keeps expanding to other organs. So with stage 3, it tries to make pockets of its own, being that this blood has nowhere to escape, so it will start forming pockets. And these pockets, you find that we have this blood collecting here, and we call them endometriosis chocolate cysts. So it's always taken to be with, like, it's taken to be found of, other conditions. You find that once someone does a scan, the scan will show a cyst, but may not differentiate it with endocysts. So that's why most people see these cysts, most doctors see these cysts, and then at times call them physiological cysts, the cysts that come in the middle of your cycle. At times these ones are normal, and after your ovulation, of course, they disappear. But for endo, it doesn't. However, the only diagnostic procedure that at least will give you that definitive test is the laparoscopy. Laparoscopy is a procedure it's done on your abdomen. We make incisions. The gyne will make incisions, like 3 cuts on your tummy, on your lower part of the abdomen, to detect this endo. Of course, they will look inside with a camera on the screen to detect that disease. When we look at the signs and symptoms of endometriosis, it has very many signs and symptoms. We have chronic period pain. We have a pain during sexual intercourse. We have low back pain. These ladies get chronic migraine headache. You find that at times there are girls that are in school, and because of the period pain, they faint and collapse. So it keeps on growing. And it's one of the leading causes of infertility. So you find that these ladies go through all these symptoms. So when we are going to look at the management of this condition, but before that, I think I'm going to take you through my journey with a condition. And when you look at what I went through with this condition, you find that most of these ladies, yes, we have almost similar signs and symptoms. However, our journeys may be a bit different. So I grew up in a good family, I should say. We were 9 at home, 6 girls and 3 boys. So at 14 years of age, I started my periods. They were never clear blood like any other person. Of course, my mother is a nurse. She had told me that, at this age, at a certain age, a woman will experience their periods and they should be normal. It's what I know. So at 14 years of age, by then I was at school, I found myself in severe pain to realize I had dark spots coming out. So it was so painful, and I had to leave school back home for a week. For that full week, I was in pain. I used to roll down. I used to, having like diarrhea. It was so crampy. And, my mom was like, whoa, but this is kind of different from what people go through. So I started taking painkillers since 14 years of age. I began with this, diclofenac, paracetamol. So I started taking drugs, painkillers. So the pain was severe for the full week. So 3 months later, I didn't see my periods again. And then they resumed in the 4th month. So still they were painful, and I started getting them for 2 weeks. So my life kept on like that. By then I was 14 years, and then I kept on growing. By the time, like the more months kept on moving, the pain that used to be period pain, now I'm over like 19 years. I started getting pain before my periods. I get pain during and then pain after. And since I used to bleed for over 2 weeks, you find that I have like a week in between that I'm okay and not in my menses. So it was always hard for me. So we started seeing doctors, but of course they couldn't realize what was wrong. So not until, after my O-level, I was like, no, I think I have to go to the nursing part of it. So I went and trained as a nurse in one of our good hospitals in Uganda. So still the symptoms were too severe because it was by then as over 20 years that symptoms kept on increasing, in that all the month, throughout the month, I would get chronic headaches. And these are headaches that would never clear with painkillers. I started changing from drugs, tablets to injectables. But then it was so hard for me that I used to faint on injectables. So it became so hard. At times, like you get an injection, you faint, people had to run fluids and all that. So I resorted to tripling one of the drug we call ibuprofen.
That's how expensive women is. Here you are, you're saying you pray.
Yeah. So I started taking ibuprofen. It's a drug that tries to reduce inflammation inside, but instead it used to make my condition worse. At times you would take it, instead of this blood flowing, now you would get clots, and then it still kept on flowing for 2 weeks. So I used to take ibuprofen. After 30 minutes, I repeat, and then after 30 minutes. So I used to triple the drug so that I get the effect, so that the pain reduces. So the more I used to do that, then I started getting bleeding ulcers, like you go to the toilet and then, it's blood. Again, we moved into doctors, gynecologists. I used to move to good hospitals, but they couldn't detect this. They started seeing cysts on my ovaries, like we've seen other stages, like stage 3, you will start seeing cysts. This thing had grown from stage 1, 3, and for sure, hospitals, doctors couldn't detect it. So they used to see these cysts, but then they would tell me, Grace, I think these are physiological cysts, they were clear. They started advising me to get pregnant. And by then I was still, pursuing my other visions. So I was advised that maybe this is hormonal imbalance. They started treating me pelvic inflammatory disease, and then others urinary tract infections. And this is what most of the ladies go through. You find that this condition in most cases is detected at a later stage, which is always hard to manage. So it became so worse. I used to move to hospital and it was never detected. I just remember there is a moment because after the nursing course, I left, started working, and then the pregnancy symptoms also came in. Like throughout the month, you're craving. Throughout the month, you have no appetite. Throughout the month, you feel you're not like other people. Personally, I grew up in that isolation mode. Like you would ask your colleagues, whether people experience this, and everyone is no. My sisters at home, they had never seen this. So you're always in that mode, like not socializing with people because of what you're going through. Yes, I used to be courageous, go to the wards, work, but then after I'm having that headache that I can't show people, to the extent that I'm treated for typhoid for over 3 years because of that chronic headache I used to have. So one time I had gone back still to upgrade as a registered nurse. It was just 3 months, and then I felt that attack. It was like an attack. I felt paralyzed and then collapsed. So to find myself, I was in a hospital. But then when I tried to regain conscious, what the doctor told me was, "What's wrong with you?" I tried to explain myself, and all the symptoms I explained, someone would think I'm pregnant. So I told her I've had these symptoms for years. You know, all the symptoms of a pregnant woman, chronic pain. And then she was like, I told her, currently I'm just because I got that attack, I felt like giving birth to something. So when I explained to her that, she was like, "It seems you're trying to abort." That's what she told my colleagues. She was like, "Take her, you do a pregnancy test." I'm sure she was trying to abort. So I just told my colleagues, "Let's go for a scan." We went for a scan, and to find I had 2 huge masses on my ovaries and one had burst. So when we brought back the results to her, and that's when she apologized and then took time to examine me and then called in a gynecologist. Of course, I sat down, they prepared for an emergency operation, which we had the following day. And of course, the guy openly told me, "Grace, you know, these are cysts. We are going to work on cysts and you'll be okay." So the person who went in theater at 9 a.m., I just came back at 5 p.m. So to find that these were not normal cysts, it was already endometriosis stage 4. Like in a recovery room, like wherever, those who know our theater, we have a recovery room. So at that moment, yes, I was trying to wear off the anesthetic drugs, you know, like you're trying to regain consciousness. I would hear doctors and nurses, you know, everyone was like, "I've never seen this. What is this?" So I had them say that repeatedly. So by the time we went back to the ward, I kept asking my parents, "What did they find in me?" They told me they were going to remove cysts. It was really hard. We tried asking the nurses, they couldn't explain anything. And they were like, "For sure, this condition we've also never had, but I think doctor will come and explain to you." So he came the following day and he told us, "Yes, this is a condition called endometriosis and it's already stage 4. He told us I couldn't do anything in Grace's womb, but he just sucked out the masses and then closed. It was too hard at the moment because he told us for sure no one can handle Grace here. He suggested to take away my womb, but he was like, it will be hard because the thing had spread to my intestines. The abdominal wall was already gangrenous and my ovaries were already eaten up. So he suggested we look for better help outside Uganda. But he didn't know where to refer us to. So we spent, you know, as like, yeah, I'd just went back for upgrading. And then I was like, okay, I've been told this is a condition that doesn't heal. So we left the hospital and of course they had to test for cancer, which was negative. So he wrote us a referral letter, but it was addressed to nobody, but told us, look for people abroad. This was one of the top gynecologists we have in Uganda. So it took me a year. I was advised to leave school, you know, like going back and maybe have a dead year. But I requested them to stay, to give me a chance. I don't know, but I managed to qualify as a registered nurse in horrible pain because I was put on an injection called Zoladex. It puts you, some of these hormonal therapies we are given, put us in that menopausal state, a state where you're like an old woman, you know, a woman who stops getting their periods. So I used to get those hot flashes. It has a lot of side effects. I thought, and the gynae thought it would stop my periods and even reduce the pain, but the pain became so worse. I used to, stand in class 5 minutes, I'm outside, all that, but God used to help me pass well. So after the course, I had to go back home and maybe wait for my day. I started taking herbals, and I took herbals since like I was 20 years, and this could never help. So since we realized that no gyne would handle this, I resorted again to herbals, because at home we had not even tried to look out for gynes abroad, because we were like, we can't manage that, those costs. So it took me a year at home. And then we were directed to one of the professors in Uganda, to our main referral hospital. So we visited him, and what he told me was, Grace, according to this doctor who worked on you, we all know him and we believe he does good work. So with this condition and this stage, you will die with that pain. That is what he told me. So he told me, I have nothing to do for you. Maybe keep your life on morphine as you wait for your day. We went back home, and I just stayed home. I tried taking herbal, and we got a certain kind of herbal that tried to reduce the pain, but instead it was making the condition worse. And for me, I thought the pain is reducing. I tried getting for a job. So I started for just like 3 months in one of the big hospitals in Uganda, because these ladies are always productive. You find that you can work and people can just see really your input. So I just started working for 3 months because I had to leave home. I used to put my family in, all that trauma. All the time my sisters would look at me and they're crying. So I had to leave home and show them that, I can make it. So I had started working for only 3 months. Again, I get that tag 7 years when I had the first surgery. And then after a year, so I make 28 years. That's when I got another tag. So I felt again paralyzed and then lost consciousness. So of course, by the time still I regained, I was in hospital. Again, a scan was done, and still masses had grown faster, and one had burst again. There were always 1 of 9 and the other 10 centimeters. So the gyne sat and suggested to remove my uterus. So of course it was a bit conflicting, because some of them were like, this girl has never given birth. Maybe we'll try IVF, maybe we try something. But then they were like, no, the whole womb is gone and all that. The only reason to save me to them, it was taking out my womb. So I tried to call my brother. We have a brother, Joseph, in the UK. So we called him, I called him, and he was like, okay, let's try to research and see. He researched and found out a professor in Endo who worked on me in Nairobi. So it took us over 30 million Ugandan shillings. It was too hard. We had to sell off some property at home for my surgery. So it was really good that they provided, and then I went for that surgery. I was educated about what endometriosis is, the diet and lifestyle we have to go through. This guy did my surgery and saved my uterus. Of course, he told me, at times if someone opens and he's really not well, should I say, well knowledgeable about a condition, they will always mess it up. So it has even deposited further. So he told me, okay, with this condition and the state, Grace, I can't assure you that you will heal completely, but according to what I've done, you can still conceive. And yeah, of course, I've given a hormonal therapy, and of course to follow the diet and lifestyle. So I got back home. It was my first time in life to see clear blood, like a woman. So I saw clear blood. To me, it was really like a miracle. And the pain reduced. I found myself like something had been taken out of me. I got a new life. And that is when I sat down with my family and I'm like, you people, I think it's time we came up and save women going through this. So that's how we came up with Endometriosis Foundation Uganda, to really save and support women going through this condition. And that's how we went to have this. And according to the services we offer as Endo Uganda, sensitization to the general public and medical professionals about self-care management of endometriosis. We do counseling and health education. We support women with this condition live a better life. You know, we do follow-up on treatment, and we also support these ladies access effective and affordable healthcare. However, you find that as a foundation, we have challenges, and the cost for the laparoscopy, the surgery done for this condition, is really expensive. You find that it used to be like at 11 million in Uganda, and that was, yeah, it would be done, and of course someone comes out again with pain. However, we are privileged that on the foundation we have 2 gynecologists that we work with. At least they have good information about this condition and can now handle. Of course, it's now a bit reduced to over 5 million, and depending on a stage, because stage 4 is always extensive, and of course they always need a surgeon also to come in with stage 4. That's why at times it stays like 15 million. So it's really expensive for these ladies. Just imagine a woman with this pain from 14 years, so they're always in hospitals. And the challenges we have, that these are ladies that will always say, we move to hospitals, you're in horrible pain, and people at, health workers say, you're either faking this pain or it's taken to be normal. So yeah, we have offices, main office in Rengo district in Uganda, and in Kampala we have a contact. So you find that social media has really helped us create awareness. It has helped us create awareness. Ladies calling from different parts of the country, East African countries, and they need our help. We have people calling from London, from all these other countries, because it's a condition that is not a gynecology condition alone. It's a team. These people are affected mentally. And you find that, yes, someone can do a good surgery, but if this lady is not supported psychologically, they're not going through that diety and lifestyle, of course it will reoccur. So as a foundation, we come together, we share psychologically, we help these ladies. We have day outs, we share, we have to go through these therapies. Exercise is very important. You find that through the mental wellness of it, these ladies get into depression. I suffered depression for over 4 years. And most of these ladies have suicidal tendencies. Some of them will come to you and they are on antidepressants. They are referred to mental hospital, but when they join the support group, all this is relieved. And they really tell you for sure, I'm now off drugs. We really support them because most of them are not understood by the society. Most of them have family breakups because even the men don't understand this. Endometriosis is not a woman's condition, it's a man's condition too, because they will call upon men always as we talk about it, because they are our supporters too in this. And on that note, I would like to thank Peter for this, because sorry, when he heard about this journey, he heard about endometriosis, he was like, no, I think I shouldn't sit at this. More people need to know about it. We really thank all the people that really reach out to us for us to create more awareness about this condition. Just know we are impacting lives. Still mentally, we talked about the depression. These ladies get panic attacks. They're always in stress, but when we come together, all these are solved as a foundation. We've tried to work according to the limitations we have. We try to work according to the means we have. We have challenges that at times it's hard. We would love to move out to different parts of the country, different East African countries, but at times finances limit us. So we try to work according to the available means. You find that endometriosis, most of these young girls in school are affected by this. And through awareness, we are trying to move into schools and then hospitals, though it's not enough just because at times we are limited by support. We have over 100 ladies, like I've said, but only 5% of the ladies are on insurance. So the rest have to struggle and strain to get support. Personally, I use my salary to share with the Endo warriors. The little I have is what we share. And we also thank Joy for Humanity Farm organization that has really come up to support us, to support where they can. We have IRISE East Africa. They are also trying their best to help us raise awareness. We thank VAC Foundation for this move, and we believe you're impacting lives. We always call upon partners that would wish to join us and support these ladies. We shall be grateful. Any funders out there? Your support would be highly appreciated because we have over 20 ladies that are due for surgery, but we are trying, they are straining to get the finances. You find that some of these ladies have gone through surgery and maybe some guys go ahead to handle something they can't really handle. And then someone is messed up with. So to the extent that now it becomes worse and hard to be managed. So some of these ladies are referred outside Uganda, which becomes so expensive. However, we thank our gynecologists still in Uganda, the ones we work with that have tried their best. They're trying. Yeah. So when we looked at the management, yeah, we see that therapies, exercise does as well. Yeah, from my surgery, I realized I got a better life. The pain came back after within that year. I was like, now I've had a good surgery, but still I get a pain. I called my gyne and then he was like, Grace, I told you, according to your state, it was really worse. And you may still have the pain. But I was like, no, I said no to painkillers. And today I'm managing endo with diet and lifestyle. I'm okay, much better with just only minimal pain that doesn't need painkillers. And most of these ladies lose their jobs because even our employees fail to understand. You know, a woman who is always monthly, you're out of work, you're off work. But we really stand to talk about this and, you know, empower our employees that these are women that are so productive. But when given a chance, they can make it. When we look at this diet, we have the fruits, we go off dairy products, we go off wheat products, we limit carbohydrates, and then eat these fruits, they really make us, you know, well. We have a lot that we eat, fish, nuts, white meat is very okay with us. We do take millet porridge, beetroot to keep boosting on our blood and all that. we always have, like, we encourage exercise, pelvic exercise. These help us a lot. Actually, they are very good therapies and treatment for endo. We help people go off painkillers as long as they try to go by the diet and lifestyle. Once someone has had a good surgery, depending on the stage, if you don't go with the diet and lifestyle, to most people it reoccurs. So this has kept us moving up to date. Yeah, basically that is it.
Thank you very much, Grace. But before I make comments, I just want to hear if there's other people who want to ask Grace. Thank you for sharing your story. Very heartbreaking, but also very inspirational in understanding how strong you are as a person, considering what you've gone through, and inspirational for you coming up with a way to help others as well. So I'll just let the others comments. I will just tell you, Grace, there have been a few people who have put in some comments in there. So thanking you for sharing, and thanking you for bringing mental health and psychological issues which are often neglected. That's a comment from Lillian. Inspirational, powerful from Ben. Eye-opener from another person, and very inspirational from another person. And and it paints a very good, a vivid picture of what victims go through from Lillian. And Adelaide, only imagining how your journey has been. So thank you for sharing, really. So I'll just is there anyone who wants to make a comment? Grace, there is a comment in there that we might want to be able to help out. Can you are you able to share your can you tell us a little bit about how we can reach out if we would like to help out?
Sorry about the question. Sorry.
Do you want me to repeat the question?
Yes.
Yeah, so if we would like to help out, do you have a website that accepts donations? Do you have something that you can share that we can use to help out?
Yeah, we have a website, though it has not been so active. We have social media platforms. We have Twitter, we have LinkedIn. You just go in and tap to Endo Uganda, Endometriosis Foundation Uganda. And then we have an account number for the foundation. Yeah, I don't know if we can, yeah, and maybe my contacts, I think if we can share the contacts and then.
Yeah. So I think we can catch up with you a little bit later, Grace, to discuss how we can increase your visibility through when we share this video, to discuss how we can increase your visibility in people with people who want to help out, and how we can support you to do that as well. I think there was another question that had been raised. Who was raising their hand? I think was it Shepard or? There was another question which has been raised. Just check on charts as well. Is there somebody who wants to ask a question? Or share?
I think raised her hand. I don't know if it's by error or what, but Lillian is raising her hand.
Oh, yes, yeah, absolutely. Lillian, we'll give you the floor.
Okay, thanks. Well, mine is not a question as such, but I would like to applaud Grace for this initiative. I'm sure if people are going to go for a vigorous approach in identifying people diagnosing endometriosis, mostly you would find people maybe in stage 3 or 4, which is even expensive to go through the treatment. So the approach will also help in early identification of people with the disease. And resources usually are wasted when people are looking for a diagnosis, and sometimes they're even misdiagnosed. So if there's an awareness campaign, the disease can be picked up earlier and people can get the right diagnosis earlier. So this is a very good initiative, as Yangama has highlighted before. The financial support on visibility should help a lot of people. Thank you.
Thank you, Lillian. Can I ask Grace, are you aware of any other foundations doing similar work in other countries other than Uganda?
Yeah, actually, we are in partnership with Endometriosis Foundation of Kenya, because
Yes.
like we said, it's not a one-man condition, it's a team. Actually, psychologically, it's what we need mostly. So through the Endo Kenya, mostly, I also got my support from that foundation, that through those ladies are able to stand. I'm like, okay, I can move on. We can really make this. So we have been collaborating with them. And for the cases that are had to be managed here, they are trying to help us and kind of reduce all the costs. So they help us in that way. Though to our ladies, yeah, we have a few that have gone for these good surgeries. That is especially for stage 4. It's really hard to manage. Yes, our guys here are trying, but at times that thing reoccurs, and at least they can try to do that good work. So they help us in that way. I also know of Endometriosis Foundation UK, Endometriosis Australia. Yeah, and I think through these platforms we shall, get more connected to them further. Yeah.
Maybe my last question is on those ladies you said would need support. Yes, you were talking about Ugandan shillings. I'm trying to convert how much support is it necessary to have those. How much does it cost, first of all, for a laparotomy, and how much does it cost to support those ladies?
Yeah. For those that have never done laparoscopy, that is for diagnostic, basically, and management, because nowadays it's diagnostic and management, because you can't detect through the signs and symptoms. So for those, through our foundation, depending, because we have a health facility that doesn't have the machine on its own, that is in Rengo district. Yes, we have the facility, it has the maternity wings, but the machines are not yet in position. But these guys are trying to work with us, reduce on the cost for the endo warriors. So these costs have not been fixed, that they can be at 5 million. That is for stage 1, 2, diagnostic and maybe management. But then for someone with stage 3 and 4, it can go up to 17 million Ugandan shillings. That is in Uganda. That is stage 3 and 4 one can go up to 70 million. But there are those that have had like 3 to 4 surgeries, but have never had a change. She has had surgeries here and there are no, they're not getting results. We have like, I think like the way you can see on these pictures, most of these ladies are the ladies with endo. And one of them, I don't know if you can notice well, she has endo of the uterus. Her uterus is frozen, and then she has lung endometriosis. She has been managed for over 3-4 surgeries, but she has never gotten relief in Uganda. And we are hoping that if we can have chance to, refer her outside where she can have good management. This can be out now with all the costs, transport and all that treatment. I think it will cost like, in Nairobi, it would be like 30 million plus everything. Transport, accommodation and surgery. Yeah, but those at early stages, they can be managed here. At stage 1 and 2 over 5 million, and then for stage 3 over like 15 or 17 million.
Thank you very much. I was just busy trying to convert that to US dollars to understand the amount. So yeah, somebody's done the conversion for us there. So it's about 1,300 US for stage 1, stage 2, stage 3, but it can go up to about 5,000 US dollars per patient. So yeah, thank you. Thank you very much for that. I'm not sure whether maybe we can talk about that outside this platform. So organize a catch-up meeting so we can then discuss where we can support you a bit more. But I would like to thank everybody who has attended and who has shared your personal story with you. I am actually thinking, this is just me thinking aloud, that on our platform for that we work with Hexacon, which is available in 16 countries, I think we should have a course on endometriosis, just as a frontline type CPD or micro-credentialing course, something like that, that you can lead and help us to be able to disseminate this information across all nurses in Africa. So I think that will be a helpful thing to do, but we can discuss about that later. But I think it will be worthwhile being able, your willingness to share your story and your journey, and also just being able to educate other healthcare providers. I must say I've worked in emergency departments all the time, and I see women come through, and the possibility of misdiagnosis is just huge. It's just huge, especially when it comes to teenage girls. You are thinking about a lot of other things, and the last thing that you'll be thinking about is endometriosis. So thank you very much for sharing, and I'll just do a last call for questions, and then we can close the meeting. Thank you very much, Grace. I don't see anybody raising up their hands or asking more questions. As I'm also assuming that this has been a big eye-opener, and it's a lot to take in as we digest. So questions might come up, but if you want to contact Grace, the email address is in the chat. The social medias have been put in the chat as well, so which is very helpful. But thank you very much for sharing, and thank you everybody for attending. We hope to run at least one of these sessions once every month with different people from different countries sharing their inspirational stories, what they are doing in their countries that might actually give us ideas and stuff, and we might be able to support each other. So thank you very much for attending. Say you are on mute, Grace.
Yeah, thank you so much, Young Man and VAC platform, for organizing this. And we are privileged to be part of you, and thanks for accepting to work with us. Yeah.
Thank you. All right, thank you very much, guys. We'll call it a day, and we'll just catch up with you on the emails. I've got a lot of follow-up things to do. Thank you.
Okay, thank you. Thank you.
Bye-bye.